How's it going, everybody, man? I hope y'all having a wonderful, blessed day. Today I got y'all some video clips and news clips about organ harvesting in America. Is it really as scary as many are saying it is? It's literally on the news about people that weren't even dead yet and they were trying to take their organs. I heard one story about a dad that literally went and got a gun and held his son hostage. He had a hostage situation where the doctors was trying to take his son, and instead of him allowing them to get his organs, man, he got a gun and had a hostage situation till in the middle of it, his son apparently woke up. So the dad felt something, and and as parents, if you ever in that situation, I pray none of y'all are, and I'm never in. Don't let them just talk about call a certain thing that you're gonna hear in this video. Anyway, I want y'all to have the fuck.
An alarming story, to put it mildly. HHS Secretary RFK Jr. is calling for reforms to the U.S. organ donation system. This comes after an investigation unearthed a whole lot of reports of doctors, American doctors, trying to remove organs from patients who still showed signs of life, brain activity. Secretary Kennedy says, quote, "Our findings showed that hospitals allowed the organ procurement process to begin when patients showed signs of life, and this is horrifying. The entire system must be fixed to ensure every potential donor's life is treated with the sanctity it deserves." So let's bring in the HHS organ transplant chief, Dr. Raymond Lynch. Doctor, thank you for joining us on this. Going to read you this quick New York Times headline. Doctors were preparing to move their organs. Then they woke up. A federal investigation found a Kentucky nonprofit pushed hospital workers towards surgery despite signs of revival in patients. Does this shock and horrify you as much as it does a layperson like me to hear?
Yeah, I think everybody has a right to expect better from the system than what we saw in our investigation.
To not be murdered, essentially.
Well,
to have your organs harvested.
To be clear, the investigation did not find that. This was that the individuals were not being appropriately evaluated, meaning that they weren't doing a good job or an acceptable job identifying the individuals who could be organ donors.
All right, well, let's talk about this, though. The study that your organization carried out found at least 28 patients may not have been deceased at the time organ procurement was initiated. So how do you, what is that? What do you describe that as?
So not to get too into the details, and I'm not in any way undercutting the investigation here and the need to do better. But what we found in our investigation was that those 28 individuals did not have a time of death, meaning that, again, this organ procurement organization, the group that the federal government pays to do this work, it was finding individuals who did not go on to pass away. That does not mean that they had an operation to recover their organs, but it does mean that they got care that was inappropriate to them.
I see. Okay, thank you for clarifying. That is an important distinction there. What are some other, out of 103 cases, the HHS study found 29.3% showed concerning features?
Yeah, so this is something, again, that I want to stress that we expect better of the system. The main features here were that they were not doing an adequate job identifying patients who could be organ donor candidates, or if they made that initial assessment, that they didn't update it in light of new clinical information, and that they didn't work collaboratively with these hospitals and show appropriate respect and deference to the wishes of the family.
I see. All right, well, doctor, we have to leave it there. Thank you for taking time out with us. We wish you the best going forward reforming this.
Thank you.
What a story.
Imagine a doctor removed your vital organs while you were still alive. Well, an investigation found that at least 28 patients across several US states may not have passed by the time that theirs began to be removed. Such as a 42-year-old woman in Alabama who was still alive when a surgeon started cutting into her chest. Now, this is particularly a problem in rural areas and has led Trump's Health and Human Services Director Robert Kennedy to announce an overhaul of the organ donation system, saying, "Our findings showed that hospitals allowed the organ procurement process to start when patients showed signs of life, and this is horrifying."
Families of people who died in prison fighting to keep their case alive, trying to hold the state and the University of Alabama in Birmingham accountable for harvesting the organs of their loved ones without their permission. The defense claims an agreement was made between the Alabama Department of Corrections and UAB, allowing the university to perform autopsies on those who died in state prison. UAB's lawyers moved to have the case dismissed on the grounds that state agencies have immunity from wrongdoing while performing their duties. Families allege that ADOC and UAB illegally took custody of their loved ones' body parts, conspiring to confiscate the organs during the autopsies and committing fraud while harvesting the organs and profiting from them. According to the lawsuit, the pathologist performing the autopsies harvested the organs for future use as specimens for medical students. A group of those students investigated the matter for themselves in 2018, discovering that 23% of the university's yearly income comes from these autopsies. The results of the hearing have not been released at this time.
170 million Americans are registered organ donors. Well, this morning, some in Congress say the public trust in the donation system is eroded after reports that dozens of supposedly dead donors actually showed signs of life.
The system really looks to be in need of an overhaul. Comes after multiple accounts of close calls where patients' organs were almost harvested accidentally while they were still alive. Services Administration's investigation was initiated last year after a 2021 case in Kentucky where a man was believed to be brain dead from an overdose, but doctors were wrong and surgery was called off just moments before he was taken off life support. A physician noticed the man moving and moaning while being taken to an operating room. Well, the man did survive all of this. And now Health and Human Services is announcing they want to improve the organ transplant system. Secretary Robert F. Kennedy Jr. is saying the organ procurement organizations that coordinate access to transplants will be held accountable. The entire system must be fixed to 73 cases where the doctors signed off for organ retrieval, but the patient wasn't fully dead.
Patients dying, but they take the patient's organs before they die. That's euthanasia. We want to make sure that the American public knows that if they are willing to become an organ donor, they're going to be treated humanely and legally, and that the family's wishes will be respected.
And for those of us who have checked that box, you want to make sure that it's done right.
When they find out what's happening behind these organ, just the way that we harvest organs and give organs to families and breaking hearts, Ms. Knuckles, Ms. Martin, I'm truly sorry, and it is shocking. It's also, I'm going to use a word you don't hear very often, it's evil. It's evil to rob families of the hope, to mislead them, to take organs before any organ should be taken. I'm really sorry. So I've got a picture behind me, and I want to ask Ms. Erickson, can you explain what I'm looking at with this picture behind me, Ms. Erickson?
Yes, Congressman. According to a whistleblower, those are boxes of human organs that are sitting on shelves, including human pancreases.
So pancreas. Now, if you donate a pancreas, shouldn't they go directly towards somebody in need of a pancreas?
Yes, sir. That's what families agree to.
So why aren't they going? In fact, I know why they're going, because there's a loophole in the law that says that
Yes.
you can use them for research. Is that correct?
Yes, sir. In 2020, CMS finalized a new regulation that said that OPOs only get credit for organs that are actually transplanted. But the loophole allowed them to declare credit for pancreases that they said were recovered for research.
So the people that donated these organs thought they were going to save a life or do something big. Have we, as CMS, defined research or put any timeline on what research is?
No, sir, they have not.
How many pancreas do you know have been harvested since 2020?
Over 7,000 across the United States.
Is there any, do we know the data that came from the research? Do we have any info that these pancreases were actually used for research?
Sir, they were not. Since 2020, islet cell transplants have remained flat, while pancreas harvesting has exploded with no proof at all that they were used for research.
The investigation, and thank goodness the Oversight Committee, I want to give kudos to them. The reading is again, shocking and evil. It showed that on a single day, the New Jersey Sharing Network threw out threw out 100 pancreases after federal agencies started investigating this practice. Ms. Erickson, what does that mean for patients? They threw them away. What does that mean for patients? 100.
It means that 100 families in New Jersey, on the worst day of their life, because they lost a loved one, a wife, or a child to a car accident or some other injury, said yes to organ donation. They were lied to, and their loved ones' organs were cut out and left on shelves to exploit a CMS loophole. And Ranking Member Sewell, this happened to hundreds of patients in Alabama too, and I'm happy to send you that data.
Our report shows our Inspector General found examples of OPOs, organ procurement organizations misusing Medicaid dollars on everything from sporting events, limousines, retreats, five-star retreats, breaking the law on their nonprofit status. Ms. Erickson, an OPO CEO, Tom Moen from One Legacy in Los Angeles, gave a presentation about money in organ donation. He suggested that in America, it is the OPOs that hold the purse strings and that they only need the acquiescence of payers. Is that correct?
Yes, sir, I've seen that presentation, and OPOs have clearly acted like they are in charge, inflating their costs with million-dollar salaries, such as that of Mr. Moen, and executive perks that have nothing to do with patient care.
Who pays? Who is the payer when it comes to organ transplants?
The largest single payer is Medicare, so the taxpayer.
And that's us. And that's us. Mr. Chairman, thank you for shedding the light. For everybody with a camera or watching, thank you. And if you're in media, this needs to be on the front page of every newspaper and on every newscast, that there is waste, fraud, and abuse, and it's shocking and it's evil. So, Mr. Chairman, I look forward to working with you to restoring trust. This needs to be a place of hope, of saving lives, and not of the abuse and the shocking evilness that we've seen. I yield back, Mr. Chair. Good morning.
Brain death is a lie. So people don't even realize it's a lie anymore. But it's been a lie from the beginning, continues to be a lie. They invented brain death mainly to get organs, but then also so they don't waste money on treating people who aren't ever going to get a job, who are just going to live and not die. And so to see what brain death is, it's primarily a way to get organs. You cannot get any organs from a cadaver. Every organ that's transplanted is a healthy organ, and you can only get healthy organs from living persons. You cannot get any organs for transplant from a cadaver. The things I'm telling you is that you are not allowed to hear, because if you hear it, you will be upset, as all three of you are upset. And rightly so, you should be upset. Whose organs do they want? Certainly from all children, but especially the people who are 16 to 30, and their life is in jeopardy. If they're unconscious and on a ventilator, they're going to get their organs. Everybody who's called brain dead has a beating heart, circulation, and respiration. If they didn't have that, you wouldn't have to call them brain dead. You could call them dead.
She rises from the ashes, stronger than before. A warrior with a heart of gold, ready to soar. Through struggles and pain, she finds her way. Empowered and fearless, she seizes the day. She's a queen in her own right, a force to be reckoned, breaking